that we need all our elected officials,
The other dock is back
Democrat or
there.
Republican, to be serious about it. Say hello. Healthcare now! Healthcare now!
That means we get health care reform.
What do we want?
Health care
Now! What do we want?
care now.
What do we want?
Care now.
What do we want?
Health care now.
Healthcare now!
Healthcare now. Healthcare now. Well, we should be telling Wally. Let's go.
Why don't I go out there and then you can, I can talk to more people.
Okay, terrific.
My name is Fran.
Hi, Fran. Good morning.
Good morning. I am asking your concerns to my boss, who's Wally Herger. This is a standard procedure for us when we have visitors and groups like this. It's an input form. I do not need your name or email. We're not going to.
Community and our health centers around the area. But the other thing is, right now in Sacramento, they're taking a vote that will lop off 300,000 children from health families as we speak, maybe by the end of the day. This is America. This is a first world nation. We shouldn't be having to face those kinds of choices, particularly for our young people. So we need the congressman deeply involved in fixing those kinds of things. I know he's a good man. He wants to work hard for the community, and I think you're hearing the voice of a lot of folks who really want meaningful health reform. So,
He's met with you before.
oh yes, many times.
I'm Lynn Dora. I'm also from a community health center. I live in Montgomery Creek and work in Round Mountain. But I want to represent the perspective of a small business and say that healthcare is breaking the backs of small businesses and putting us in a position to either provide what our employees need or break the bank. And they're impossible decisions that are horrible every day. And I think that's what makes it such a bipartisan issue. So I really want to ask for his willingness to engage in real compromise dialogue and come up with some sort of a plan that can be a beginning.
That is asking Wally Herger to step up to the plate, represent all of our interests, to be inclusive in all healthcare, and to provide a real leadership that we need at this time. And I think no American should be left behind. I think we should strive for healthcare for all people. And we plan on calling Wally Herger today, so that's going to be, we'd like to talk to him as well.
Hi, my name is Gail Mello, and while I speak for myself, I believe I also speak for many displaced workers throughout California. When my husband's business went under, we purchased Cobra, which the company not only immediately canceled after taking our money, but didn't honor our bills that were run up. Through no choice of our own, we were unable to find any coverage that would take us. We looked into HIPAA, which was over $2,000 a month for us. My husband's unemployment is $1,900 a month. Our prescriptions are $1,600 a month. So we are left with no insurance. We can't afford our prescriptions. We can't find employment. We are definitely in a bind here, of course. We qualified for HCTC. For those of you who don't know what that is, it's a health care tax credit, which allows you to be credited back 65% of what you pay in a health care premium. That doesn't extend to Northern California because we are outside of the only coverage area here in California, which is Kaiser. They are the only ones. If you are not in a rural area, if you're outlying or you live in a rural area, you are unfairly discriminated against. You cannot get that coverage because you're outside of their 50-mile radius of their health care area. We're not one of these people who keep being alluded to as, oh, we're just mavericks out there who are taking a chance on having to go to get medical care. We desperately want and need medical care. I have a letter here that is not a form. I've taken a great deal of time to write this letter. I refuse to fill this out because I do not want one of the form letter, cookie cutter responses. Here is my handwritten letter to Mr. Herger. I would like a personal response.
Okay, let's make a phone call to Herger's office in Washington, D.C.
202.
And here's our little prompt, right here.
202-225.
One person.
3076.
And say there's 110 people here in his office in Reading, along with his staff person from Chico, Fran.
Hi, we're calling you from Redding, California. We have, from Mr. Herger's office, we have 110 people that have attended a march and rally for healthcare for all, and we'd like the Congressman to know.
We'd like to speak to his staff person.
We'd like to speak to a staff person. Hello. This is Redding, California, and other areas weighing in today on a phone call to Mr. Herger to say, Mr. Herger, support affordable health care now!
What do we want?
Health care now!
Yes, health care now.
Very good. This is Paolo reporting for the Narco News associated with the field. Thank you very much.